Visual feedback is often used to help those with phantom limbs. Mirror box therapy is one of the most effective types of treatment. Mirror box therapy was used to help patients relieve pain, move frozen phantom limbs. The patient uses the reflection of a good limb in a mirror to stimulate movement of a phantom. The mirror box was used with patients of Rom, like Maribel, who was born without arms but had phantom limbs still, where her phantoms were shorter than her normal arms. This suggests a partially genetic component to the neural circuit for body image. We will also discuss Philip, whose left arm was severely torn after a motorcycle accident, and he suffered pain in the phantom elbow, wrist, and fingers, and his phantom was left frozen for 10 years after the accident. Ram used the mirror box therapy, and Philip was left with the phantom gone, but his phantom fingers and phantom palm dangling from his shoulder, but he didn't seem to have a problem with this. We will also discuss Robert and Irene, who had involuntary clenching spasms with their nails digging into their phantom hands and extreme pain, then used the mirror box therapy and no longer faced any of these problems.
Limb paralysis is a phenomenon that occurs when patients who had pre-existing paralysis in their limbs before their limbs were amputated, they resulted in a paralyzed phantom limb. But when the motor cortex sends its commands to move a limb but does not get the right visual feedback that the limb is moving, the brain will repeatedly send signals to move the paralyzed limb and will repeatedly receive signals the limb is not moving. Eventually, the connection weakens over time and the brain learns that the arm does not move. Philip, who was a patient of Ramachandran, he had his left arm was frozen for 10 years after an accident. But his arm was also paralyzed before it was amputated, and it resulted in a frozen phantom limb. And pain in phantom limbs, Ramachandran suggests that the amplification of motor commands leads to the amplification of corresponding pain signals. For example, the patient Robert, who suffered from involuntary clenching spasms and the pain of nails digging into his phantom hand, because Robert didn't have a hand to provide the right feedback for his brain, it kept telling him to clench his hand tighter and tighter, resulting in pain. Your perception can change dramatically even when your retinas stay the same, and the nectar cube is an example of this, and you can see it pointing up or down depending on how your brain interprets the image. It's kind of weird that I went from...
The visual pathways in our brains seem to have divulged at some point into an old and new pathway. The old pathway travels directly from the eye to the superior colliculus and does not reach the visual cortex, though it is concerned with orienting behavior and could have been evolved as an early warning system. The new pathway goes onto the primary visual cortex before splitting again into what's known as the how and what pathways. The how pathway sends info to the parietal lobe, which is concerned with grasping, navigation, and spatial functions, and the what pathway, which sends info into the temporal lobe, concerned with object recognition. Evidence for the divergence of these old and new pathways are seen in the patient Drew, who is effectively blind in his left visual field in both eyes due to damage in his right primary visual cortex. However, when asked about the orientation of objects placed in those fields, he could correctly identify which way they were turned. This could be because the information regarding orientation of the object did not need to go to the visual cortex, but was distributed through another pathway in the brain.